Management of polycystic ovarian syndrome can become quite overwhelming, and it's because it's a multifaceted condition. The name in itself is so misleading because polycystic ovarian syndrome, we're really hyperfixated on just one anatomical organ. But the reality is polycystic ovarian syndrome, or PCOS, is actually a systemic issue. It's a endocrine issue that can manifest with symptoms that affect from cardiometabolic health, mental health and emotional well-being, inflammation and pain conditions. It can affect infertility risk. So that list is quite large of what PCOS can affect. So it seems very oversimplified to say that polycystic ovarian syndrome is just a reproductive disorder. It involves various endocrine tissues and glands and pathophysiological processes that can cause these symptoms to manifest in patients. So we can never pinpoint, the same cause necessarily in all patients that have PCOS. In fact, it's been my experience that when we see, for example, 4 or 5 patients with PCOS that have very similar symptoms, what's actually driving those symptoms on a physiological level, once we do the testing and blood work, can look vastly different. For some people, it can be driven by hyperandrogenism, elevated androgen hormones. For some, it can be mainly inflammatory mediated or significant insulin resistance, or a combination therein of a multitude of factors. So one very important variable that we continue to see studies and research on is this one vitamin that seems to have a significant impact on the management of the physiology and the symptoms of polycystic ovarian syndrome. And this vitamin is vitamin D. And vitamin D is something that Canadians were estimated that 1/3 of Canadians actually have vitamin D deficiency. And, we have a lot of research suggesting, vitamin D is good for bone health, might be helpful for X, Y, Z, whatever that may be. But if you have polycystic ovarian syndrome, the importance of vitamin D is just to a whole different level. And so they published a new systematic review this year, and they looked at around 13 randomized clinical trials, and they compiled the data from all these studies, and they had over 800 patients or test subjects in total. And they found that giving vitamin D and correcting vitamin D deficiency led to a whole host of positive changes in patients with polycystic ovarian syndrome. For starters, the most obvious change that we could probably expect if people were to start taking vitamin D is that their vitamin D levels would go up on their blood test. So that was the number one change that they saw in the test subjects that had PCOS and were getting vitamin D supplementation. But also they found that inflammatory levels, a protein called high sensitivity CRP, or C-reactive protein, which goes up in times of systemic inflammation, and we often see with PCOS is in fact elevated, started to come down for patients if they were if they had their vitamin D levels repleted. So bringing that vitamin D up seemed to bring that systemic inflammatory marker down, which is so important because increased inflammation is one of those processes or pathophysiological processes that actually drive some of those symptoms of polycystic ovarian syndrome. Similarly, they found that increasing vitamin D status actually helped to bring down total testosterone levels. This is another pillar of treating PCOS. It's trying to bring those androgen levels back into a healthy and normal range. So something as simple as vitamin D might be preventing patients from seeing that normalization in their androgen status or their testosterone status. So bringing that testosterone down is important because it can help to resume normal ovulatory function. It can help with skin health. It can prevent hair loss on the scalp. It can prevent severity of hirsutism, hair growth in other parts of the body. So bringing that androgen level down is obviously a very important component of treating PCOS. And they also found that it helped to actually improve some cardiometabolic factors. For example, total cholesterol levels start to drop if patients with PCOS were supplementing with vitamin D. And that's a very important variable because cholesterol levels, elevated cholesterol levels, can increase the risk of other cardiovascular disease and pathophysiological factors. So there's an increased risk of developing high blood pressure. So bringing those cholesterol levels down is also an important global aspect of treating and supporting patients with PCOS. It's not enough to just say, oh, you're ovulating, that's great, while they have increased risk of having high cholesterol and heart attack for the rest of their life. So managing the cardiometabolic risk factors and managing high cholesterol is an important component of that. So it's so interesting how we can see one simple vitamin like vitamin D do a multitude of beneficial things for patients with PCOS, you know, bringing down testosterone, bringing down inflammation, bringing down total cholesterol levels. So while vitamin D isn't the solution to everyone with PCOS, it makes sense that this needs to be considered in patients that are struggling with PCOS. And an important benefit that they found in using vitamin D was that it actually increased the thickness of the uterine lining. And if patients are trying to get pregnant, the thickness of the uterine lining is a very important factor in supporting implantation and a healthy pregnancy. And unfortunately, patients with PCOS are at an increased disadvantage with this because they tend to have thinner uterine linings, and they have a higher risk of having a thin uterine lining. So bringing that uterine lining thickness up is actually a very important function of vitamin D that could be beneficial for patients that are just managing PCOS symptoms, but also potentially trying to conceive. So if you have PCOS and you're trying to get pregnant, you're just trying to manage PCOS as it is, you need to have a discussion with your healthcare provider. You need to talk to them about vitamin D testing to see if, that would be a good idea for you, because we do not advocate for just blind supplementation with this vitamin, because it is fat soluble, meaning your body can store it for months and months and months. So if you take too high of a dose of vitamin D, that can actually put you at risk of having toxic levels of vitamin D. So it's important to chat with your healthcare provider to see what is an appropriate dose of vitamin D for me to take regularly if I'm trying to conceive and have PCOS. And two, possibly considering getting it tested, because taking like the standard recommended daily dose, if you have a true deficiency, may take a very long time to correct those levels of vitamin D. So if patients have very low vitamin D status, when we do the test for them, sometimes we'll give them an appropriate dose based on their blood levels for 1, 2, 3 months. And once those levels have normalized, which we confirm by checking the blood values again, then we'll usually transition them to what we call a maintenance dose to help keep those levels where they are while they're trying to get pregnant. And then we monitor in parallel all these tests for PCOS to make sure inflammation levels are coming down, testosterone levels are coming down, how frequently is the patient ovulating. So these are important variables to consider. And it's on a very personal basis, obviously, depending on, what type of PCOS you have. So if yours isn't, based on inflammation or androgen levels, or you don't have high cholesterol, vitamin D may not be very helpful in this case, based on the results we're seeing from this latest research. But it is an important variable to consider regardless if you're trying to get pregnant, and especially if you're trying to get pregnant and you have PCOS.